Welcome to Ignite Health in partnership with Caribbean Surgery Inc. We're Dr. Allea Phoenix.
And I'm Dr. Rehana Fareed. Today's program is dedicated to celebrating, protecting, and prioritizing women's health.
Because when women thrive, families and communities thrive.
Our topic today is family planning. So, to get into it, we'll first talk a little bit about what is family planning.
Yeah, so family planning allows individuals and couples to decide if and when and how many children they want to have through safe and effective contraceptive methods and counselings. And this gives families independence because it kind of gives them that power to decide when they want to start their family and how big they want their family to be.
Yeah.
So, why is family planning important in Guyana and the Caribbean? This is something that it's not very much talked about in our communities, and I think we need to start that conversation. So, what are your thoughts?
Yes, Dr. Phoenix, I definitely agree with you. A lot of us grew up, we never heard the word family planning. Even in our practice, a lot of our patients would come in and they have no idea what family planning is. And it's extremely beneficial to women and society at large. For once, it helps to reduce maternal deaths, teenage pregnancies, which we had a lot of incidences of recently, sad, tragic outcomes. It prevents unsafe abortion. It supports women's education and economic stability across the region. Um, now that we know what family planning is and how important it is, I think Dr. Phoenix can now let us know where someone can access family planning and what services are available right here in Guyana.
Yeah, so families planning is actually widely available across the country in public facilities from as the first stage, like in the primary healthcare setting, like a health center, regional hospitals, and also through specialized organizations like the GRPA, and even at our public facilities such as our main referral hospitals and some clinics across the country. It's widely available, and a trained physician or an OBGYN can administer these services to persons that are interested.
Okay.
So, and now that we know about what family planning is, what about some of the services that you've encountered in your practice, and just overall what we know is available in Guyana?
Um,
What are your thoughts on that?
Thank you, Dr. Phoenix. I'd like to add to that most of these facilities and the contraceptives that are available in Guyana are free of cost. Um, so some of the most common one and that I see my patients would prefer would be the birth control pills, or commonly referred to as OCPs. The Depo-Provera injection. A lot of patients call this the 3-month stop. I don't know if you had
Yeah,
other names.
3 months.
The
Yeah.
implants are also common, Nexplanon or what's the other?
Implanon.
Implanon,
Yeah.
and also IUDs. I have sorry, and the male condoms as well. But a lot of persons report allergies, preference. They just don't want to
Yeah.
use the male
The
condom.
latex.
Yep.
All of those things they would consider when they're choosing whatever family planning method they think they may be interested in. Apart from just listing out the types, they can be grouped also based on their makeup. Some of them have hormones and some do not. Some of those that we've listed, such as the Depo-Provera, um, those can be hormone based, or the IUD that can be hormone or non-hormonal. So it all depends on what the patient's preferences, what they decide that they want to use. So we could first start talking about the Depo-Provera because it's widely available. A lot of persons use it, and we could start a conversation on that. So what are your thoughts on the
Okay, so
Depo-Provera?
just a little bit on the Depo-Provera. It is a contraceptive injection, and it's administered every 3 months to prevent pregnancy. Um, some of the side effects that patients report would include heavy bleeding. I think we can touch a little bit on the effectiveness. It's about, yeah.
Yeah, so the Depo-Provera is injection is very effective. Once this person is placed on this type of contraceptive method, the likelihood of them becoming pregnant while on it is very low. One challenge sometimes persons may have is that they say they have the injection and then they forget or they miss a month when they're due to take the other one, and then they have what we call breakthrough bleeding. But this is not something that happens very often. And of course, once they get back on the medication, it stops. So it's actually very effective in preventing pregnancy if the person or the couple that is involved, they don't think that they're at the right stage. Well, 3 months is kind of cumbersome, because sometimes you probably
Yes,
won't
yes.
have the time to go every 3 months. So sometimes you might want something a little bit more
Long
long term,
term.
right? And that's when persons might maybe consider the implants.
Yeah.
One of the more common ones that we use here in Guyana is the implanon. You
Yeah.
want to tell us some more about that?
Sure. And to add, it also depends on your family planning goals. So, if you know that you don't want another child soon, you want to wait 3 years before you even try, the implanon can be an option. What it is, it's basically a small rod that is inserted under arm, and it prevents pregnancy for 3 years. Some of them can go for a bit longer. I think
Up to five
five up to
years.
5 years.
Yeah.
This is also hormonal. Some of the side effects that patient would note would be increased bleeding. They would also be spotting. However, these can subside if the bleeding is continuous. You would need to be re-evaluated and maybe choose another method. Another common thing that person would bring up about this method is that they wouldn't have a period entirely, right? Which is completely normal,
With it,
right?
yes.
So most Guyanese are conditioned to see their periods every month. They call it their health. So
Yeah.
when that goes missing, they automatically get worried.
Yeah, and
But
they
that
think
is,
something is
yeah,
wrong.
yep.
But
So that is totally normal with that form of contraceptive. There's also the IUD. Um, this is a little bit more invasive to insert, but what is it? It's a small device that is placed into the uterus. There's the copper one, which is non-hormonal, and there's also different versions of the hormonal IUD.
so this one here that we have is actually the copper IUD. This one here, as Dr. Fareed says, is non-hormonal. So it works by releasing copper ions once inserted, and once that couple does what they need to do, yes.
Yes.
So it kind of works by deforming the sperm, and so because of that, it's unable to reach the egg and cause fertilization. So it's widely acceptable, and this one is often used for families, for persons that think that, they've come to the end of having babies. They don't think they want to have any more children because the copper IUD typically lasts for 10 years.
Yeah,
So, like, a lot of times for persons who think they don't want to continue having children or expanding their family, they would opt to use the copper IUD. There's also the hormone type. We don't have that one available here now.
And this is what it looks like. You
Yeah.
see the copper rod, and this is the device. You load it into here, and then you insert it inside of the vagina to the cervix, and that's how it's implanted.
Yep.
A lot of persons refer to this as the 10-year stop.
Yep.
Yeah.
Yeah, and similarly, the other one that is available, the hormone one, which is commonly referred to as the Mirena, it uses a similar principle of insertion, but the timeline is a bit different. It would last for about, it depends, for about 5 to 7 years usually is the timeline associated with the use of the Mirena. And in terms of side effects with this, it's more so related to the side effects with the implant, where some persons can have spotting or bleeding in between, but that's in the early stages. After that period passes, it would essentially subside.
Okay.
So both of these services are available in the public and private sector. In terms of other methods that are available, this is one that is most commonly used, I think, by younger population especially, is the use of barrier methods, such as the male condom. As we know, the condoms is one of the main methods to prevent sexually transmitted infection, such as HIV or other related STIs. So it's effective in that sense, but of course, it's dependent on the user, because if you don't know how to put it on properly, or if it's not stored in the appropriate way, then that could impact how well it's effective. And we have a number of ones available here. So this is a common one that's available on the market. This one comes in a set of 2, and it's usually applied just before the act of intercourse. It usually comes in a pocket here. Right, and the edges are serrated, so it's easy for the person to tear and open, which we'll do. So you could see. So the edges are serrated, and it comes lubricated so that it's a comfortable experience, and it can be rolled onto the shaft of the penis here. And then the tip is left a little bit exposed so that there's the breakage doesn't happen essentially. So of course, this is dependent on whoever the user is. You know, they might have different experiences. What about for women, you know, like?
And to add to Dr. Phoenix, in Guyana, the male condom is most commonly used and seen, but there's also female condoms that are available. It's not commonly seen here. But yeah, and a lot of focus is placed on family planning as a woman's job, right? Yeah. So following up on the next question that we have, is family planning only for women?
Yeah, that's something a lot of persons think, you know, like, well, you know, that's not really my problem. She has to deal with that. And that's not true. You know, men play an important role through this, using the male condoms or through a procedure that is available. Commonly, a lot of persons probably don't want to consider it, but it is widely available, and it's available here in Guyana. That procedure is called a vasectomy. It's a surgical procedure. It can be done as a outpatient surgery or like a minor operating surgery. And it's a permanent solution, basically, and it prevents the man from basically releasing viable sperm that can impregnate the woman or fertilize the egg. It's very minimally invasive. It's usually very effective. And if down the line you think you probably don't want to continue, it can be reversible as well. So it's an option also for that man.
And yeah, to add, it's less invasive and there's less side effects than what women have to go through with all the hormone and the hormonal birth control and so on. And also another way in which men can contribute to family planning is just by simply supporting their spouse, right? I've seen a lot of instances where men do not want their partner to be on birth control. Some men would even go would even remove IUDs. I know we've seen this, right? Yeah. Their partner would secretly get them. So another way in which men should support women and their choices is by supporting their choice of birth control. So we spoke about the vasectomy. Now we'll talk about tubal ligation, right? So this is also called a stop or cut off or a tie off.
Yes, that's what it's commonly referred to in the Guyanese population.
So it is basically a permanent procedure where the fallopian tubes are tied or sealed. So basically the fallopian tubes allow the eggs to be transported from the uterus, from the ovaries to the uterus where it's implanted. So when it's tied, this cannot happen. Exactly. So no pregnancy can occur.
And some women might opt to do this procedure maybe after they've had a pregnancy, if they had to get it by a cesarean section, and then they've decided that, you know, this is the end. They can opt to do that surgery then, or they can do it, just do the surgery on its own. So it's something that some women consider, but it's a lot more invasive because, of course, this is a big surgery that needs to be performed. Right, so it does have its relative risk. apart from that, we could steer a bit away because now the dynamics have been changing with our young people, especially teenagers. And a lot of them think that they cannot access family planning because they're too young. And yeah, they're too young, or they just don't think that it's possible, and that's not true. Right?
Yeah,
So you want to
so
tell us more?
yes, adolescents, teenagers can access confidential services, especially at public clinics and at the Guyana Responsible Parenthood Association facilities. There's also youth-friendly health centers where they can go in, have counseling done, get tested. At all health centers that I know, they have condoms and different forms of contraceptive
Mm-hmm.
available. So this can definitely help to curb the rate or instances of teenage pregnancy in Guyana. So, Dr. Phoenix, why do you think teenage pregnancy is still high in parts of the Caribbean? What are some of the factors that you would highlight that contributes to this?
All right. So with teenage pregnancy, it also comes down to the information that is available to young persons within schools and in communities. They may have limited education on the topic. Sexual education is something that is still relatively kind of taboo in the school setting. So if we're able to be a little bit more responsible with it, not necessarily condoning the behavior,
Yes.
but giving them the necessary information so that they can be well aware of it. Also, there's still some degree of cultural stigma and inconsistent contraceptive use, especially in low socioeconomic background persons who are a bit poor. They probably aren't aware of it, and also they might think that they need the necessary funds to source it. So I think that is
Mm.
where we do see some limitations in terms of appropriate education of our young people and teenagers, because they feel that their hands are tied and they can't really access this information. In some cases, uh, things happen, and we might need to use emergency contraception. Now, what's this emergency contraception that we speak of? I'm sure that our audience is very eager to learn about this.
Yeah, so the emergency contraception, this is commonly called the morning after pill. So as it says, it's only to be used as an emergency. So it's a pill, a combination. It's a hormonal pill that you take within 72 to 120 hours after having unprotected sex. So a point to note, there is some limitations. For example, the time frame in which you take this,
Mm-hmm.
also the weight of the individual.
Yeah, a lot of persons don't actually know about that
Yes.
weight part. When the first time I learned about it, persons were amazed because technically after I think it's 70 over the 70 kg, it's not
It's not
very effective,
effective, correct?
which was like very surprising to me. And some of my colleagues,
Yes.
they were very surprised, and so even some patients, because they might be early in pregnancy and then they didn't
They
know
say
that
that
it didn't work because
yes,
of that.
yes, correct,
So
correct.
yeah, definitely. And some persons thinks that the emergency contraception, you can use it in place of the other things that we talk about, like the pill or the
Oh no,
injection,
definitely
or
not.
as a means of abortion, which is not
Which
true.
is
That
not
is
true.
not safe sexual health practices, because it does work to prevent pregnancy, yes, but it should not function like to be in
And
place
just
of appropriate
correct
family
family
planning
planning.
methods that we
Mhm.
have mentioned about significantly. So let's say we do have a patient and they want to decide on what family planning method to use, and they decide, oh, I want to use the birth control pills. What about the effectiveness? What can we tell them about this?
So with regards to the birth control pills, it should be noted that they are 99% effective. However, they should be taken correctly, meaning at the same time each day. And you have to be consistent with that, because if you do have an event or you miss a pill or a few pills and you don't double up, to say,
Mm-hmm.
correctly, you can become pregnant. So it is 99% effective when taken correctly.
Exactly. So there's actually something called like effective use, like which is what you've
Yeah.
described, and typical use. You know, it's sometimes you might miss the time or you might miss the day, and with that, the effectiveness kind of goes down from the 99% to 91%. So definitely, the person needs to be very diligent if they will be opting to use this type of contraceptive method. Um, as we talked about before, there are common side effects that are seen with the hormonal contraceptives, and we've touched them briefly already. But some of those side effects that we've talked about is the irregular bleeding, weight changes, which can be more in the positive effect where we have weight gain. And usually that happens because the most of the hormonal contraceptives, they have progestin inside, and it tends to increase your appetite. Increase your appetite, and then of course if you're eating more, then you're gonna gain weight, right? Yeah. So what we would usually tell persons is that, you know, if you feel like you're gonna eat a lot more, try to get some more fruits and veggies available.
Yes, correct.
So like that's the first thing that your hand comes to. Some persons might even say that they experience a little bit more headaches or breast tenderness, and they can improve over time. These aren't necessarily symptoms that they will experience throughout the continued use. What about if a woman can get pregnant immediately after stopping contraception? Is this possible? Depending on what type, what do you have to say about this?
Okay, yes. The birth control pill, one of the contraception in general, a lot of persons have a lot of misconception that once you're on it, it becomes increasingly difficult to get pregnant. You might not get pregnant, you know, a lot of this. But there have been studies that show that they do not really affect fertility once you if you're using the pill and you're off this one. Some persons are able to return to fertility quite quickly. So it is fertility can return quickly after stopping the pills, IUDs, implants, or even with the depot. It can take several months, but ultimately it returns, right? It does not prohibit you or cause you to stop having children altogether.
Something else to note, I think, is related. So after that woman is pregnant, you know, she's breastfeeding and she's noticing that, you know, I'm very consistent with it, and I've been a little naughty, but I haven't been getting pregnant. But there's actually something called lactational amenorrhea. And so it works by that mom consistently breastfeeding her baby, exclusive breastfeeding without stopping. And by doing this, it kind of regulates your hormone system in such a way that you don't get pregnant within that first 6 months. After the first 6 months of breastfeeding, it's not so effective. So in that case, then the persons may need to use some other method. But yes, that is the reason why it happens. There's something called lactational amenorrhea, but it has to be in a
there are conditions for that to work.
Exactly. Yes. The person needs to be exclusively breastfeeding. What about dual protection? You know, like some persons, they don't necessarily they might not necessarily use the pill alone, or it might be a case where they use the pill and then they miss a day. What would they do in that instance?
So dual protection, what I want to highlight here is that a lot of people on contraception, it prevents pregnancy, right? It does not prevent STIs. So condoms are the only form of birth control that also protects against sexually transmitted infections. So using dual protection is basically using condoms plus another birth control method to prevent pregnancy and STI. So if a patient says, "Oh, I'm on Depo-Provera, you know, I can't get pregnant," they're still at risk for getting STI if they're having unprotected sex. So
yeah, especially if they don't have one regular partner as well, right? Because you know, if you have multiple partners, then of course your circumstances would differ, right? So there are also other methods some persons would rely on as opposed to using the condoms or the hormonal methods. Some persons prefer the natural methods. So fertility awareness methods can work by requiring like strict monitoring and tracking. So some persons can actually track when they're ovulating or track when they're entering their luteal phase, which is basically a part of the
Yeah,
menstrual
cycle.
cycle. So different phases that we go through. So some persons they would opt to do that instead, and it can work in some cases, but you need to know there's some risk that is
Risk, yes.
associated. So some persons, if they know the specific days that they're ovulating, they would tend to avoid having intercourse during those time to reduce the risk of pregnancy, I
Yeah.
would say.
And I
Um,
think this method too only works if your period is regular,
yeah,
right? So if you're missing a month and you're getting it the next 2 months, it does not work. You have to have regular periods for that
yes.
method to work. Um, what about family planning with women who has certain medical conditions? Is it safe? What are your thoughts on that?
I think it's very safe because with certain medical conditions, I think we need to plan better for like pregnancy and stuff like that because you want to get everything to under control before you
Correct.
consider having a child. So, yes, it's very important and it's very relevant. So, persons who have high blood pressure or even diabetes, heart disease, in these cases, these people need to be closely monitored during their pregnancy. So, by having a family planning method, you give yourself a chance to appropriately plan. And so, if you do decide that you want to start a family or you want to continue growing your family, that you are in doing it in a safe manner and you're involving your healthcare provider, whether it be a medic, a doctor, a nurse, whoever it is, and you're doing it in such a way that is safe for you and your family. And of course, women can do this by visiting their nearby clinics and so on. So, what can we tell them more in terms of how often they can go about accessing care related to
Access
family
and
planning?
care. Okay. So it depends. Usually most women are exposed to family planning when they're having their first child. So after you deliver that baby, they would say, okay, yes, you have to join family planning clinic, and
Mm-hmm.
the healthcare worker would now give you all the options. So it really depends on which option you choose. So if you choose the pills, which are monthly, you can go back every month to have them replenished. They'll monitor you for side effects and so on. If you choose a Depo-Provera, usually a visit to the health center is or a healthcare facility is every 3 months. Again, they will monitor you for side effects and and follow up follow up care. In terms of IUD, the initial visit they would insert that, and follow up is annually.
Mm-hmm.
Of course, it's up to you to do your annual checkups and so on.
Yeah, and then of course, as
To
symptoms present or if
yes,
anything
and a
comes
sim.
up, you
Correct,
could
correct.
visit based on your concerns or your needs that you think are relevant. So it's patient dependent
Patient
because
dependent.
some persons they might have it and nothing happens and they just go about their day, and then some persons have different side effects. So
Yeah.
it's individual based. In all of this, I think the Ministry of Health has a very big role here in Guyana. So the Ministry of Health supplies the different forms of contraceptives, and it's available widely across their different health facilities, the public setting, our main referral hospitals, and also private places as well. It's available for free, so I think everyone should make it their business to reach out to source these services that are available.
And of course, be informed, what's available to them.
Right.
So,
So regional organizations also play a large role in, family planning measures and so on, not only in Guyana but in the diaspora at large in the Caribbean. So the Caribbean Family Planning Affiliation supports national associations and it at promotes productive health advocacy, which we see in this slide is
yeah,
very important,
important, correct.
especially in our setting where I think it's a conversation that needs to continuously
Yeah.
progress. What about religion? What are
What
your thoughts?
thoughts on how religion affect family planning in the Caribbean?
Yeah.
Well, there are some religion definitely or religious beliefs definitely can influence patient's decision. However, it's like you said, patient dependent. It's up to the individual and the
Mm-hmm.
patients, and our role as healthcare workers to encourage our
Yeah.
patients to make informed and personal health choices that's beneficial to them.
Yeah.
So we did touch a little bit on the infertility aspect, which relates to contraception, if contraception causes infertility.
Yeah,
So
no, we've already said that, it
yes,
doesn't cause infertility, it can even be a tool, to
the truth.
use in certain conditions to help that person um, achieve fertility. So it's not necessarily a source of infertility. Um, what should someone consider when choosing a method? Should we consider a few things? Well, what about the age, like a reproductive age person or a premenopausal person? What should we tell them?
So I think their age, when how many kids they need to have, what are the age gaps, their
Mm-hmm.
current financial situation, their health
Definitely.
conditions,
Mm-hmm.
the desire for future children. So some persons just want one child, some persons want 10. So
Yeah,
so it's what their
yeah.
desire. I think convenience, what's readily accessible,
Mm-hmm.
what they can afford, if they need to buy, if it's not available in the
Public
public
setting.
system, and what they need for their lifestyle as well in terms
Yeah.
of their sexual history.
So yeah, all in all, I think it depends on the individual and what
Are their needs? Yeah,
are their needs and family goals. So I think the overall goal of family planning in the Caribbean and in Guyana is to promote healthy families, safe pregnancies, reduce maternal mortality, empower women, and just have stronger communities, where no one is scared to have the conversation on family planning and just doing the right thing where that's concerned.
I agree. Thank you.
Thank you as well. So that's it for this episode of Ignite Health in partnership with Caribbean Surgery Inc. Family planning is about informed choices and shared responsibility.
If you have questions, visit your nearest health center or speak with a qualified provider. I'm Dr. Fareed.
I'm Dr. Allea Phoenix.
Thank you for watching.